I said, "My name's Graham, I'm your nurse." He's turned around to me and he's king hit me.
When I was pregnant with my daughter, I was punched in the stomach by an intoxicated patient.
This has been 3 years since I've been assaulted and it's not getting better. The system needs to change because it is on the rise. It's not going away.
Hospitals are where we go when we're ill or injured and need help the most.
We're often seeing people as nurses on the worst days of their lives. So we certainly have a lot of emotions that are running high. We also have people coming in with alcohol on board. We have people coming in with substance misuse and mental health issues, and sometimes they will have all three. A bit of a recipe, I think, for the potential for violence.
Am I talking to you?
This is the first time that I've been here since I was assaulted here in February of 2016.
For the first time in 2 years, Graham Levy's returned to the scene of a violent crime that ended his nursing career.
I went to work as I usually did. I was given a patient to look after who was critically unwell.
Graham loved being a nurse, a job he's done since 1992. Until one day in February 2016, when he was working at Macquarie Hospital, a mental health facility in northern Sydney.
I said, "Hi, my name's Graham, I'm your nurse. Would you like some hot water for a cup of coffee?" He's turned around to me, started screaming at me, swearing, and his king hit me. He was a large person, much larger than me, taller, heavier. King hit me. I was stunned. He hit me again. I went to the ground. He then kicked me twice in the head, kicked me in the abdomen. Injuries to the abdomen, which caused a 15 centimetre hole to be kicked in my abdomen as a result of the assault. My limit of movement in my neck, and I've lost 8% hearing on top of that.
It's okay, I'm here. It's okay.
Despite growing awareness of the dangers nurses face and campaigned to highlight them, the problem is getting worse, not better.
I'm not going anywhere, I'm staying here!
According to the Victorian Crime Statistics Agency, the number of victims assaulted in that state's healthcare premises has increased by 60% since 2015. And crime data in New South Wales shows that over the same period, assaults on hospital grounds are up by 44%.
What can you tell me about the vital signs here? So when we talk to nurses, 90-95% will say that they've experienced violence. Usually this is verbal violence, so this might be swearing, threats, that type of thing. Type 2 is diabetes mellitus.
Jackie Pitch is a lecturer in nursing at Sydney's University of Technology and has written widely about violence in hospitals.
Good. And how about protecting yourself as well? A lesser percentage will tell us that they've experienced physical violence, but this is still typically well over 50%, so more than half of nurses telling us that. And they're telling us that they experience that frequently, so often it's a daily occurrence, or it can be even more than a daily occurrence.
That doesn't mean all those incidents get reported.
Sister's trying to help me.
Often nurses will tell us that they get blamed for episodes of violence rather than getting support. They're actually blamed for somehow causing this, which makes them reluctant to report.
I think underreporting is a global phenomenon. How's everything looking?
It's been a busy day, actually.
Okay, I wonder if we can see them up here.
Lita Olsen is an emergency nurse at Royal Brisbane and Women's Hospital and a member of the Queensland Government unit tackling occupational violence.
We've got 4 specials running at the moment.
Wow.
2 of those are quite aggressive males.
Lita's been a victim of violence at work herself.
When I was pregnant with my daughter, I was punched in the stomach by an intoxicated patient, but I can honestly say that I don't know a single one of my colleagues who hasn't been exposed, whether it be threatening behaviour, verbal abuse or physical assaults.
Queensland's Health Department encourages reporting of even minor incidents. As a result, overall incident numbers are significantly higher than other states. They're also rapidly increasing, up by 48% over the past 3 years.
We've got many down in forcing burns.
Increasing the powers of hospital security guards is one suggested answer to this complex problem.
In my opinion, I actually believe they probably should have some greater powers, and I certainly don't expect them to be able to arrest people or taser them or things like that.
If we have a high security presence in hospitals, then we're creating almost a prison-like environment rather than a healing and a caring environment. So I guess we have to be careful to manage that.
Security guards didn't arrive in time to save Felicia Pickham. The mother of 4 used to play with her kids at their favourite jump park in Queensland's Hervey Bay. That's just not an option anymore.
Now I just feel like I can't do things, and it's horrible on me because I feel like I let my family down. I can't believe that this man that had me for about 3 minutes has made such a big impact to my whole life.
Felicia says an attack by a patient at Hervey Bay Hospital in 2016 has done lasting damage to her body and her mind.
Well, I just went to lower the bed rail so he could get into bed, and they could help him get into bed, and out of that he lashed out and he got me, and my life has forever been changed. He was standing, so he had full force. He was about 6'4" and about 130 kilos. He's grabbed my arm and he's ripped me up like you'd start a lawnmower, I suppose. Eventually, I think he'd pulled my arm about 7 times before he did let me go. And then I left the room, of course, and security had arrived by this stage.
Felicia says chronic nerve damage causes constant pain and made her right arm virtually useless. Felicia's suing the hospital for damages, claiming practical nursing work is now impossible.
I don't want this to happen to anybody because it's not fair.
These senior nursing students certainly weren't thinking about violence when they chose this caring career.
It is a big reality, but I think I've sort of come to accept it a bit more.
It's a bit concerning, yeah, that people think that it's okay when it's not.
Okay, he's in VTAC, guys.
I go in there to help people. I wouldn't expect people to harm me.
Felicia Pickham now struggles to keep up with her 3 youngest children. With her 19-year-old son serving in Afghanistan, she's no stranger to careers which put people in harm's way. She just doesn't think nursing should be one of them.
It's not getting better. It's not going away. And I just feel that the system needs to change because it is on the rise, and I don't want this to happen to anyone else.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.